Well, it can be hard to talk about, but pelvic organ prolapse is a condition that affects hundreds of thousands of Australian women. For more, we're joined by pelvic floor physiotherapist Shan Morrison. Welcome, Shan. Now, I imagine this is a topic that isn't openly discussed by a lot of women, but it can cause them a lot of distress, can't it?
Hi Karen, yes that's right. Pelvic organ prolapse is a common health problem, affecting half of all women who've had a baby. As a pelvic floor physiotherapist, I see many women with a prolapse, and if it's become severe, it can be quite devastating and impact their self-esteem and their enjoyment of life.
Okay, so explain a little bit more about what exactly a prolapse is.
Well, there are different types of prolapse, but basically it's when any of the pelvic organs, so your bladder, uterus or rectum, move down and bulge into the vagina. So it's like a hernia, and when severe, it can bulge out of the vagina. Now that can sound quite scary, but there are varying degrees of prolapse, and if it's mild, often women won't even be aware of it. Typically, women will describe a heavy or a dragging feeling in the vagina or a lump in the vagina, and sometimes there's bladder leakage or difficulty urinating or emptying your bowel.
Okay.
Women often won't seek help until they're very aware of the bulge, by which time it is harder to treat. There are health professionals, including pelvic floor physios, who specialise in this area, so the sooner women seek help, the better. You can see the details up on the screen, and that number is 1800 33 0066, or of course you can head to the website continence.org.au for more information.
So what happens when someone calls that number?
Well, the National Continence Helpline is a free service staffed by continence nurse advisors who provide advice about symptoms that you might be experiencing, as well as resources for further information and where to seek help.
Yeah, it is great to have that support. Do we know what causes prolapse?
Well, childbirth is the main cause of a pelvic organ prolapse, which affects half of all women who've had a baby. The pelvic floor muscles and the tissues that support the pelvic organs are stretched during birth. And the more vaginal births you have, the more likely you are to have a prolapse.
Right.
So it can be soon after birth or years later, even after a hysterectomy. Other activities that can place strain on these muscles include chronic coughing due to poorly controlled asthma or smoking, heavy lifting such as washing baskets or children, and straining on the toilet due to constipation. But whatever the cause, help is available and there are very effective treatments.
Yeah, I had no idea how common this is. So are there things we can do to help prevent it?
Absolutely. Prevention is definitely the better option. It really starts with pelvic floor muscle exercises to keep those muscles strong so they can hold all the pelvic organs in place. The National Continence Helpline has resources on how you can do these exercises, or viewers can go to continence.org.au for information. It's also really important to maintain a healthy weight, to avoid constipation by consuming adequate fluids and fibre, avoid heavy lifting, and of course smokers should quit smoking.
Yeah, definitely. And if women have had a prolapse, how do they go about treating it?
They should see a doctor first for an assessment and diagnosis. Women can also phone the free helpline for more advice and to find the location of their nearest pelvic floor service. A pelvic floor physiotherapist can provide a personalised pelvic health program that can reduce prolapse symptoms and stop the progression of a mild to moderate prolapse. And this would typically involve pelvic floor exercises to strengthen the muscles and lifestyle modifications. More severe cases of prolapse might need to be managed with surgery to repair the damaged tissues. So there are several treatment options, but the most important thing is for women to take that first step and make a phone call so they can resume living a full and active life.
Oh, absolutely. It's so true. Shan, thank you so much for coming in today. And for those of you at home, if any of these sounded all too familiar to you, please give them a call, 1800 33 066, or go to continence.org.au for more information.